Hi guys, this is Dr. Chalam. I'm the founder of Holistic and Integrative Center of Novi, or Holistic Icon. What do the words holistic, integrative, traditional, functional medicine mean? And I'm going to try and explain it to you in this video. So holistic, we jokingly say, holistic practitioners see patients with a whole list of problems, but actually it is taking into account mind, body, and spirit. Most physicians who practice different from a traditional medical practitioner try to take into account the mind, body, and spirit and try to effect healing. Integration is where you're seeing a traditional medical practitioner. They do diagnose, treat you with medicines, but they're integrating other modalities like adding supplements or complementary medicine like acupuncture. So it's a little more broader approach. They too are trying to effect better resolution, but it's not one of those things that leads to resolution, because we got to do a very important part when you're trying to address resolution. You got to get to the root cause. And root cause is usually done with what we call as functional medicine. Functional medicine is a different way of thinking. They ask only two questions. Number one, what does this person need in order to heal? So what are they missing? And what does this person need to remove in order to heal? Is there any toxin, a toxic relationship, a toxic job? If we can answer those two questions, usually we can get to the root cause, and then there is complete resolution. These other modalities may make you feel better, but I'm not sure about resolution. So how do you decide which one is the best kind of practice for you? So the way I'd like to explain it to people is through what we call the health meter. So we have health and wellness on one end and disease and disability on the other. Now, what you need to understand is health and wellness is not what I call, it is not an absence of disease or an absence of symptoms or something where you're not taking medicines, therefore you're healthy. Health and wellness is a true sense of physical and psychosocial well-being. And the way you would know, are you truly healthy? These are the few questions you have to ask yourself. When you wake up in the morning, do you wake up with some stiffness that gets better as you move? Then you're not truly healthy. Do you wake up in the morning and say, I gotta have my first cup of coffee, otherwise I cannot think, I cannot do anything, and that's when I get my energy? Then you're not truly healthy. You have some symptoms. Now, why is that we don't realize that those are symptoms? Because when you talk to other people in your circle, they all have similar stuff. So you believe that's the natural process and that's the natural journey to aging. And what I want you to understand is at no time should we have symptoms that are regular and chronic. Symptoms are like alarm saying your system is not functioning and you need to do something about it. And what do we do about it in the traditional medical world? If we can get over-the-counter medications, that's what we try. You have heartburn, you take Tums. But if you go to the doctor, you tell them, hey, you know what, I've been having heartburn, I've stopped spicy foods, I've stopped caffeine. The doctor is trained to put all of these symptoms and give it a name and say, oh, you probably have GERD or gastroesophageal reflux. And the solution or the tool they have in their toolkit box is a drug. And once they give the drug, they've reduced your symptom. In other words, they've reduced your suffering. That's why the word patient means sufferer. And that's what we're trained to do. So your GERD goes from this to a lesser level, but it doesn't get back to health. It's not like you could live without the medicine. Now, what happens is as time goes by, you accumulate different diseases and therefore different medications. And that's what we expect in this relationship, in this journey, and from our healthcare. You go to the doctor, you want a diagnosis, you want a drug, you want to feel better. Ultimately, you want to feel better. But what if you understand that from health to disease is a journey, and what you need to do to get healthy is not a drug, but a journey back? And why would you need to think this way? Because There are two types of diseases we get. Diseases that we get and diseases that we develop. Diseases that we get was something that was killing us in the past. The plague. And the CDC may want you to believe the flu kills us, but the flu can. Urinary tract infection, septic shock. These are all diseases that we get because something from outside attacks us, and we're able to find a medication, an antibiotic, antiviral, or antifungal that really saves us. That's the acute care medicine. That's what traditional medicine has always been good about. Unfortunately, with the same principles, when you apply to disease that we develop, like we develop high blood pressure over the years, we develop high cholesterol, we develop diabetes, we develop lupus, it really does not work. What happens is you just accumulate these medicines and the diseases, and you actually get worse. The numbers may get better, but you get worse. Does that make sense? Because you have to understand, a journey to illness can only be addressed by a journey back to wellness, not by medication. Now, if that kind of approach and that kind of thinking makes sense for you, here's what I want you to do. You may not be actually ready to partner with a functional medical doctor, but you may want to know, am I a candidate that actually will benefit from this kind of an approach? Pick up the phone, give us a call. I've posted our information in the link below. And also, you can go onto our website and create an appointment. The first appointment is a 15-minute free consultation over the phone. And the reason we do this free is we want to make sure we can actually help you, number one. Number two, we are a good fit for each other. This is an extremely important relationship. This is not driven by insurance where you keep changing your doctor based on your insurance and nobody really knows you. This is a relationship where we have to get to know you because we got to know your journey to illness to get you back to wellness. So if all of that makes sense, make sure you do make use of that 15-minute free consultation. And remember, I am Dr. Shalom, founder of Holistic and Integrative Center of Novi, and Holistic Icon, or any functional medical practice, has to be the place where you find your best doctor, and that's always you.